Good afternoon, everybody. Good morning, West Coast. Hello, everybody, for joining us today for our webinar of the day of our Let's Talk series, Being Seen, Heard, and Respected with Dr. Gary Kaplan, medical director and founder of the Kaplan Center for Integrative Medicine. We know that people are starting to trickle in, but right now we are just doing introductions. But we're happy you're here. And if you know anyone else that's attending that may have forgotten or is running behind, just make sure to give them a nudge and to join us. So today we have a lot to cover, so we're going to breeze through this. Next slide, please. And I will give an introduction to Dr. Gary for those who are not familiar with Dr. Gary, if it's your first time getting to know him and our work. Dr. Gary Kaplan has over 40 years of clinical experience in treating and diagnosing immune-mediated chronic illnesses. He's one of only 19 physicians in the country to be board certified in both family and pain medicine, associate professor at Georgetown University, and author of 2 books, Total Recovery and Why You're Still Sick. And then to gauge the room, we're going to start off with a poll here, just to gauge who's here with us, how everyone's doing. So the first question really applies to everyone here. Which best describes your connection to this topic? And I just wanted to share with everyone, this is being recorded. Your personal information will not be shared. It is completely hidden. We are not going to try to hit you with a bunch of marketing. That's why we had a form that you could check off no. This is really just an icebreaker, but so the options here are: I'm living with a chronic or invisible illness, I'm a caregiver, family member, or friend, I'm a healthcare professional, I'm a patient advocate or community member. And then the last 2 questions that you'll see really just apply to those that are more patient. So if you're someone that's ever experienced debilitating issues or just feel like you haven't been heard, have you ever felt that your symptoms or health concerns were dismissed or misunderstood by your friends or your family? And then the other question, very similar, but applying to a medical caregiver, if you ever feel like a doctor or someone that you were seeing just wasn't listening to the symptoms that you were describing. So while I let folks finish filling that out, I'll share a little factoid here. Did you know that many chronic illnesses including ME/CFS, fibromyalgia, long COVID, and chronic pain disorders often appear normal on routine medical tests despite causing significant disability? And that disconnect can make patients feel unseen, unheard, or misunderstood. So there's nothing worse than when your labs are saying everything's fine, but you know you are completely not fine. So, all right, I think that's enough time. So I'm going to end the poll and share results here. So it seems that most of the room, 57%, say that they're living with a chronic or invisible illness. There's some family members, caregivers, friends here. And we have one that's a patient advocate or community member. And then for the second question, if you feel misunderstood ever by friends or family, the response is all pretty much often or sometimes, which is no surprise here. And what about with medical field? Often, sometimes, rarely. So that's good. At least there's some rarely there. So that is all for my introduction. I will see you all at the end for our survey and for our Q&A session with Dr. Gary. But with no further ado, I will let Dr. Gary go on and present. Thank you.
Together, thank you. I appreciate all the work you've done getting this lecture together. You've done a spectacular job with the slides, and I appreciate all the work you're doing. So I'm Dr. Gary Kaplan. I'm founder and medical director of the Kaplan Center for Integrative Medicine. We got a lot to cover today, and the focus of what we're going to be talking about is being seen, heard, and respected. And certainly when you're suffering, but also when you're dealing with people who are suffering, because this chronic illness affects not just the person who is struggling with it, but it affects virtually the entire family and all intimate friendships. So this applies pretty much to an illness others may not fully understand. You know, when you break a leg, you've got a cast on. So at least you can have some sense of people being able to see the external wound. When you are struggling with a lot of these other diseases, that's not the case at all. Next slide, please. So what we're going to explore today is the softer side of medicine, if you will, but probably the most important. The body remembers traumas and long-term healthcare, adverse events of childhood. These have long-standing impacts, and we'll go over those. When medicine itself becomes traumatic and PTSD occurs as a result of your interaction with the medical field. Parents, especially those whose kids are suffering with PANDAS, absolutely brutal situations for them. They're desperate to find better answers for their kids, and they're frequently dismissed by the profession. The experience of having one of these invisible illnesses, that is, you look good, and Mae West once said, it's not how you feel, it's how you look, and darling, you look marvelous. But the reality is, it is how you feel. How to help someone who's suffering? We want to talk what medicine needs to learn from all this. And then also some points perhaps on how to advocate for yourself with a chronic illness. Next slide. So the mind-body connection, what we actually mean. It's not all in your head. There's a real biological relationship between stress, trauma, and physiology. The immune system gets damaged. The brain itself gets damaged. And now we're looking at these situations where there's chronic neuroinflammatory disease in a large number of these conditions. And we're now starting to ask the question, since we know that Parkinson's and we know that Alzheimer's and other degenerative neurologic diseases that we tend to associate suffering much later in life, we're wondering if how many of the people who are not being addressed now are potentially being set up for those diseases later. So this has a potentially very long impact on your health. And so it's crucial that we understand the stress relationship. And stress, by the way, as one of our physical therapists likes to say, Jean, she says, stress is when your mouth says yes and your stomach says no. Stress is necessary. We need it to grow. We need, you lift weights in order to stress the muscles in order to be able to help them grow and put out the hormones that are necessary to keep us healthy. So stress in and of itself isn't a bad thing. It's stress feeling helpless and hopeless. That's a very bad thing. Next slide, please. So the physical component of this is one thing, right? If you're in a car accident, if you're dealing with the chronic pain, there's real consequences in terms of the system because of what's going on with the limbic system, what's going on with the HPA system, hypothalamic pituitary adrenal system. But there's a second wound. And the second wound in these conditions of ME/CFS, fibromyalgia, post-treatment Lyme syndrome, PANDAS, chronic pain, post-COVID, which, by the way, the new data coming out on post-COVID is grossly underestimated the condition. JAMA just published an article that said we're looking at 12 to 13 million people who have ongoing symptoms as a result of COVID. So this is a very serious virus, and we want to take it seriously and make sure we're treating it aggressively. But with all of these people, one of the problems they have is they look fine. They're told that, nah, your problem is you're just anxious, you need more exercise. Everyone gets tired. For those of you who are fortunately tired enough not to kill anyone when they say these things, the reality of the matter is this is incredibly dismissive and wounding. These illnesses can be utterly life-altering. They can destroy your ability to pursue your career. They can destroy relationships. They can destroy your identity. And so there's a second wound on top of the illness itself, and that's the wound of not being believed and not being seen. Next slide, please. The body remembers. So let's go all the way back to ACE, Adverse Childhood Experience Study. All right, this was done back in the 90s. It looked at 18 categories, or 12 categories actually, of childhood adversity before age 18. Each category counted as 1 point on an ACE score. Next. So the kind of categories they looked at, next slide. The kind of categories they looked at was physical, emotional, and sexual abuse, neglect, exposure to domestic violence, parental substance abuse, mental illness in the household, incarceration of a household member, loss of a parent. What is common to all of these is a sense of insecurity within the household, a chronic sense of needing to be on alert because there's danger. And I can't tell you how many patients over time we have found were sexually abused in childhood and they've never told anyone until we're taking the time to sit and listen. That they were brought up by a narcissistic parent who just was completely negligent in terms of the child's own feelings and emotion. And children are smart and they adapt and they do what they need to do in order to survive. Okay, the end result of which is they neglect their own needs and they start aligning with the parent and the pain body, as has been expressed by Eckhart Tolle. They start aligning with that pain body and they're taking on pain that isn't theirs. But they do that in order to keep themselves safe. So this business of adverse events in childhood are far more common than is frequently acknowledged. And if you have three or more of these things, we'll go on to the next slide, lots of very bad things happen later in life. Depression and anxiety, substance abuse, cardiovascular disease, autoimmune diseases. We're talking cardiovascular disease, autoimmune disease. If you have three or more ACE on the score, basically your risk of having an autoimmune disease or cardiovascular disease, diabetes, obesity increases by 25% above the rest of the population. These are not just bad things that happen in childhood. These are things that potentially have lifelong impacts and life-shortening impacts. So this childhood abuse, childhood neglect business is a very serious thing and needs to be paid attention to. Next slide, please. The prolonged stress in critical developmental windows, especially so if we're seeing this happening before the age of 5, the damage tends to be more severe, but the damage is severe as long as it's happening at any age. And so it turns on or screws up cortisol regulation. It screws up the balance of the autonomic nervous system, balance between fight or flight, okay, or rest and digest. It heightens pain sensitivity because of the cortisol signaling in the central nervous system, and it screws up your immune function. So your immune system either overreacts, underreacts. You end up with inflammation at times when you shouldn't be having inflammation. So there are very real, very severe physiologic consequences of this prolonged stress, especially in these critical and developmental windows. The body adapts to survive, and adaptation later can become illness. Next. So this is a busy slide with a lot of stuff talking about what happens to your physiology as you go through all of these crucial developmental periods, but it has an impact on how your brain is wired. It's an epigenetic modifier. It literally changes what genes are expressed and what aren't expressed. The immune system gets compromised. You end up in a chronic inflammatory state, and you can see chronic emotional and behavioral changes as a result of this. You can see disruption of the hormone systems in terms of cortisol levels in particular. You can see problems with altered immunity, and then the brain itself literally gets remodeled as a result of these chronic stresses. So you have an impaired response pretty much across the board in your immune function, in your neurologic function, and these are long-lasting, but, next slide, don't necessarily mean they're forever. So trauma is not a weakness, and admitting to having sustained these traumas is not a weakness. It's actually the beginning of healing. There's a physiologic response to these overwhelming experiences. A healing relationship matters because the biology can change. There is plasticity in the system. So being understood matters and feeling safe matters. All of this makes a difference in your healing. Next, please. Medicine becomes traumatic, and those who have dealt enough with the medical care system know exactly what I mean by this already. Next, please. So post-traumatic stress disorder, okay? You know, we think of PTSD as being associated with war. We think of it being associated with really horrific experiences, car accidents, uh, witnessing death. But the reality of the matter is PTSD can also emerge from medical experiences. Chronic illness is a trauma. It's not the only disease. It is this business of feeling helpless, hopeless, fear, dismissal, uncertainty, and invalidation. We know from studies that after prolonged ICU stays, during cancer treatment, complicated procedures, periods of prolonged uncertainty can produce PTSD. And indeed, 1 in 6 adults reported having their health concerns dismissed by a healthcare provider, and that's incredibly damaging. Next. So the phrases that wound, right? Your labs are fine. You're catastrophizing. You're deconditioned. You need to just push through. You just need to reduce stress. Okay? Short answer to most of that is bullshit. They're not looking at you. They're not listening to you. So this is a situation, you can go on to the next one, where you've heard this enough times, and I can't tell you how many patients, my average patient has been through anywhere from 15 to 20 different practitioners and clinics. Some have been very helpful and useful, but many, unfortunately, have been very dismissive. Trauma is shaped when someone feels powerless, unseen, trapped, and unsafe. So it's not only the event itself, it's the experience one has after the event. For many with invisible illness, the medical system becomes associated with fear. Not relief, not safety, but fear that you're just going to be dismissed again. I talked to a dear friend of mine who struggles with chronic illness. The idea of seeing another physician for her is incredibly anxiety provoking because she's terrified she's going to get dismissed, terrified she's going to go through this whole story and just say, oh, you're nuts and I don't want to see you. So this is a problem for medicine. You're not the problem, the profession is. Next, please. So parents fighting for children. And again, those of you at PANDAS in particular know this. So PANDAS is pediatric acute onset neuropsychiatric syndrome. PANDAS, same thing, except specifically caused by strep infections. What happens in these situations? You have a sudden onset of neuropsychiatric symptoms linked to some cause, in some cases to an infection and immune dysregulation. Dramatic changes overnight. These sweet, lovely kids suddenly develop obsessive compulsive disorders, anxiety, tics, eating restriction, rage behaviors. I had one kid who did thousands and thousands of dollars of damage to the house when he went through these rage attacks. And yet, in between, the sweetest, loveliest kid you can ever imagine. Cognitive changes, focus, concentration, school grades drop from A's to F's. Absences dramatically increase. And you can have cutting behaviors and you can have suicidal ideation, which is one of the most terrifying things a parent has to deal with a child. Families often spend years searching for answers, and many feel dismissed, blamed, or viewed with suspicion. Indeed, I have had parents who have been reported at Children's Hospital to social services under the guise that they believe they're abusing their child because they don't believe what they're seeing. And you know, you can have this kid come in who looks completely fine at the point they finally get him into the ER, whereas 20 minutes earlier was threatening their parents with a knife. All right. And it happens that fast. And it really is completely disorienting. And it's quite tragic what happens because we're not listening. And in the emergency room, they frequently don't even know how to begin to handle these situations. You know, there's a landmark study, Cerebra, and others, PANDAS in the United Kingdom, found parental blame and accusations of exaggerated or fabricated or induced illness were extremely widespread. And indeed, I've heard that from my parents of kids suffering with PANDAS on an unfortunately regular basis. Next slide, please. The trick is holding uncertainty without dismissing suffering. Not understanding a disease does not mean the patient isn't suffering. Humility matters in medicine. Listening matters in medicine. Patient often knows something has changed before medicine can explain it. And it really is something that we struggle with because there's pressure on docs to diagnose something, slap a label on it, give a prescription, and get the patient out. And if it's not making sense to them, their tendency is to kind of dismiss it, decide that it's psychiatric and chip you off. So you're not being heard, you're not being respected, and worse is you're still very sick. Next slide, please. So medical empathy is actually an incredibly powerful thing. So in 2023, there's a review of the meta-analysis, 455 studies found healthcare providers' empathy was associated with better clinical outcome, better patient experiences, better treatment adherence. 81% of the studies found a significant positive association between empathy and patient outcomes. And in 91% of randomized trials, the bottom line is our paying attention, our being respectful, our listening to you is in itself therapeutic. It's not about the prescription. It's about paying attention to you and being respectful to you. Next slide, please. The invisible illness experience, next. So the problem is invisibility hides the severity. Someone may look healthy while internally experiencing crushing exhaustion, pain, cognitive dysfunction, dizziness, sensory overload. Most of my patients complain of problems with light and sound sensitivity, which is incredibly disabling because when you have lots of light and sound sensitivity, it's hard to go out because you get overwhelmed. Your brain starts to literally hurt and short out. And then what it leads to is post-exertional collapse. So sure, you go out, spend some time with friends, try and do something enjoyable, but then you pay for it. And you pay for it not necessarily for an hour afterwards. You pay for it potentially for days or weeks afterwards, where you are literally down and in bed. This is things that the average individual cannot relate to or understand because it's completely outside their experience. So this business of crash is a very serious problem, and it's very incapacitating. Next slide, please. The worst thing you can say to somebody who tells you they're tired is, "I'm tired too." This is dismissive. This is not even beginning to understand the level of pain and the level of fatigue that people with these conditions are struggling with. And it's not that these people are being malicious, and it's not that they're being dismissive intentionally. They just interpret your complaint through their ordinary experience without understanding that your experience is far from completely, totally out of the ordinary. Next slide, please. The other thing that becomes a problem is silence. That is, when people give up complaining, all right, or reporting what's going on. Silence is misread as improvement by others. Oh, you must be feeling better. You haven't been complaining about the headache for days. You haven't been complaining about the pain for days. You haven't been complaining about fatigue for days. Where in fact, more often is resignation. Grief, the person they were, their lost futures and changed relationships. I was talking with a young woman this morning who has been through so many therapies, she's afraid to have hope anymore. She's really just kind of done and wants to take a break. And she said to me, "If I stop, will I get worse?" And the answer to that question is, her case is no, but she's not going to get better. But it's completely legitimate to pull back and regroup. Because the reality of the matter is, there is nothing more discouraging than trying another therapy and it doesn't work. So we're struggling with this process of people who are very, very sick with medications and information that is not quite ready to fix all of these problems. So it's a battle. And it's not because we're not trying, but the reality of the matter is we still have a lot more to learn. We are learning. We are growing. The medicine we do today here in the clinic is dramatically better than the medicine we did 5 years ago for all of you guys. But the reality still remains is we still have a ways to go. Social invalidation of these conditions worsens the distress and isolation. You know, the number one thing in longevity, the number one thing that predicts longevity is your posse. Are you connected with friends and community and family? When you get isolated from that, it shortens your life. And these diseases are incredibly isolating. I have patients who have been sick so long, the family just kind of works around them and carries on things around them. And they're starving to death for some level of not just validation, but some level of support, emotional support, just for acknowledgement. So people may not need everyone to understand, but they need to believe. They need them to believe. They also need them to be able to express love and compassion toward them. Next, Liz. Which, by the way, is very different than sympathy. Love and compassion, I think, is far more healing. Sympathy is good, but love and compassion is, I see you, who you are is important, even as you are right now. So how do you help someone who's suffering? Next slide, please. Simple statements. I believe you. That sounds incredibly difficult. Without any judgment on it or without any dismissal to those statements. I may not fully understand, but I know it's real. And then the easiest thing to say, and perhaps the most important, is what do you need? What can I do for you today? Do you need advice? Do you need help? Or do you just need someone to listen? Or do you just need someone to sit here with you and give you a hug? Doesn't have to be active. It can be very simply being present and respectful of the individual. Just sitting with them, keeping them company, listening to them, giving them a hug. Hugs are really, really therapeutic and important. Next, please. You got to get out of the trap of comparing. Don't say, well, everyone gets tired. They already know that. Okay? What they're telling you about is a sense of severity that's very hard to communicate. A loss of function, of loss of agency in their life. Validation is not diagnostic surrender, it's humane care. People spend enormous amounts of energy appearing normal because they're trying to protect others around them. They don't want to be viewed as the sick one. And the reality of the matter is it is an exhausting act to keep up. So at the point that someone tells you how bad it is, it's usually pretty bad. And your job is to sit and listen. You don't have to necessarily do any more than that, but sit, respectfully listen, be present with them. Next, please. My profession has a few things it needs to learn. Next. We need to understand that illness without clear biomarkers are often psychoanalyzed way too maturely. Okay? When we don't understand something, we assume, well, you must be crazy, so go see the psychiatrist. You must be depressed. You must be anxious. Go see the psychiatrist. Go see therapy. Doesn't mean that therapy isn't important as part of this process, because when you've been struggling this long and you've lost so much, there's a lot of grief to process. There's a lot of anger to process. But that's a piece of the problem, not the problem. Psychological factors influence health in everyone. If you're depressed following a heart attack, your odds of dying are dramatically higher than if you come out of a heart attack and you're still feeling optimistic and in recovery emotionally. Unexplained illness is not the same as imagined illness. That's something we also have to explain, because doctors start to feel helpless and hopeless when they can't help you. Our job is to fix things. And when we can't fix things, we don't feel good about ourselves. And not infrequently, we treat you poorly as a result. Not an excuse, not acceptable, but it is the reality of what happens. The absence of complete understanding is not evidence of absence. This is really important, because it's taken us many, many years. We didn't even acknowledge chronic fatigue syndrome as a legitimate disease until 2015. I was on the Committee for Health and Human Services on the MECFS advisory committee, and it took that long before NIH and the Institute of Medicines were willing to acknowledge this is a real disease and it exists. And I can't tell you how many people were dismissed, told they were malingering, because doctors couldn't understand the disease. Next, please. Medicine needs more trauma-informed care. It needs a whole bunch more humility. It needs more listening, and that's a problem, because unfortunately, the way the insurance companies are structuring our lives is they want you to spend no more than 15 minutes, preferably write a script and get out. But they don't want you to spend any real time with a patient. We need more interdisciplinary thinking. It is complicated taking care of a lot of these conditions. And we need to be able to talk back and forth with neurologists and neuroimmunologists and psychiatrists so that we're all working on the same page, helping you get better. It takes time to do that, and our current medical system really doesn't allow for that to happen much. We need more respect for your narrative. We need to sit and listen, and we listen to the evolution of your condition. My first question to patients is, when was the last time you were in excellent health? And the first thing most people do is they lie to me. I was last in excellent health before I got COVID. Fine. Take a more extensive history, and well, I've had migraines since I was 12. I've had problems with irritable bowel syndrome and constipation when I was a small child. And not infrequently, unfortunately, when we get into what was it like growing up at home, well, dad was pretty abusive. He was an alcoholic. Life was pretty uncertain and very complicated. So we need time to listen to these stories, because that's the only way we're going to get to the root cause of what's going on and all of the factors that we need to address. We need more research into neuroimmune and autonomic dysfunction disorders. We need more support for complex chronic illness patients. Next slide, please. Relationships change physiology. Feeling safe changes physiology. The same way that feeling unsafe changes physiology, feeling safe changes physiology to help you feel safe. Calms down your HPA axis, calms down your heart rates, okay? Reduces stress throughout the body. Feeling heard changes physiology. Feeling respected changes physiology. The nervous system is constantly looking around going, safe, not safe. Am I alone? Am I believed? How we answer these questions is extremely important. It's not metaphorical. It's biological. Chronic stress can keep the body's stress response system activated, contributing to persistent inflammation, immune dysfunction, cardiovascular disease, and impaired healing. This is crucial, as crucial as any medication that we can provide to somebody. Next, please. So how do you advocate for yourself? Next slide. And this is hard because you're exhausted, you're in pain, and you've got to find somebody who will listen to you. So you need to become an active participant in your own care. Not always fair, but powerful. That also means sometimes bringing somebody with you, having somebody, a parent, a friend, being there to be able to advocate for you, to be able to help explain the situation. You need to find clinicians who are willing to listen. Okay? We are hired guns. All right? Get very clear about this. People don't understand this. You don't have to stay with the physician you're with. If they're not listening to you, if they're not respecting you, fire them, because you need somebody who will be respectful, kind, and loving to you. You need somebody who's smart enough to think about what's going on with you and help you find answers. You don't want a doctor who claims to have all the answers, because they don't. You want doctors who are curious and who are humble. You want a doctor who says, I may not know yet, but let's keep looking together. Let's see what we can find. That may mean referring you out to other physicians. That may mean trying different therapies. That may mean additional testing. It can all get quite exhausting, because there's still a lot we don't know, and still a lot we have to learn. If a doctor won't explore your condition or help you, fire them. End discussion. Next, please. So you want to make sure that you're getting the right expertise. Not every physician specializes in every illness. Okay? You also want a doc whose curiosity is willing to look outside the box. I will tell you the experience with my wife. My wife has Alzheimer's. The doc knows that what he can do for Alzheimer's is 2 anti-amyloid drugs. That's all he knows. She had very bad experience with those drugs. I said to him, how about therapeutic plasma exchange? How about TB006? And the reality of the matter is, he sat there kind of looking at me with a blank look. He doesn't know about these drugs. He doesn't know about these therapies. And I brought him papers. It's not like we're making this up. There's good studies on this stuff. But the reality of the matter is, they don't look outside what the insurance company tells them is okay to do. So you need somebody who's willing to do that. Now, unfortunately, when you leave the insurance company, it gets expensive and not everybody can afford this stuff. But you should at least understand your options. You want to find community, support groups, and others who share your experience. People who understand what you're talking about because they are dealing with it. Keeping records of your symptoms, questions before you come in, treatments and responses to those treatments is extremely important. Trust what you're experiencing. You are the expert on your own life. So when we tell us, I had one woman a number of years ago who told me that she was having lots of abdominal pain and really struggling with feeling poorly. So we started doing testing, and the exams were essentially all normal. The initial tests were all normal. She told me she continued to feel poorly. We did additional testing, and unfortunately, what we found in her was that she had ovarian cancer. But you got to be willing to listen, you got to be willing to believe, and you got to be willing to continue to look. So don't confuse a lack of answers with a lack of legitimacy. Next, please. So you got 2 battles you're dealing with. You got the illness itself, which is already horrific. But then you have the battle against the medical profession, against society, of the invisibility of what you're struggling with. They don't see how tired you are. They don't see how much pain you're in. Patients, I drive them crazy because I ask them to rate on a scale of 1 to 10 how bad their fatigue is, how bad their pain is. And it's an approximation. It's a way of developing a language so that I have an understanding a little bit as to how they're doing and can gauge it against time. But the reality of the matter is, I talked to another patient yesterday, and she tells me she has good days and bad days. And I said, okay, let's back up. What's a bad day? Bad day is she's pretty much flat out in bed and she can't move. She feels like she's got the flu, aches and pains and a headache. Okay, that's a bad day. What's a good day? A good day, I can get up, I can do a few things. But the reality is, I said, okay, realistically, to where you were at complete normalcy, where are you back to? Well, a good day for her is about 60% by her estimate. Well, that kind of sucks. So this is what we're struggling with. And we have to take the time to listen and develop a language to help us communicate the severity of your condition as you're experiencing it. These are subjective experiences. Your experience counts. Next, please. So, I believe you is probably the single most important thing you can hear. To be seen, heard, and respected is part of the healing journey. Not because empathy cures every disease, but because suffering deepens when people are abandoned inside their disease. Human beings heal better in understanding than in dismissal. Next, please. So I thank you for your time. I hope this has been useful. It's a huge topic. There's a lot to go into here, but I hope that we've at least given you a sense of being heard, seen, and respected.
Thank you so much, Dr. Gary, for the wonderful presentation. I know that a lot of attendees that are here with us probably feel just happy to have attended it, know that there's a doctor that's listening and taking the time out of a very busy day to just dedicate to sharing some knowledge. And for those that found this helpful and wish, man, I wish my doctor could see this, or my friend who's struggling, or anybody, I will be sharing this recording with everybody. So you will have that resource. We'll also be sharing a handout. So feel free to drop it off at your doctor's office. Feel free to share this information, this deck. Just say, hey, I think this is something that needs to be done more. Advocate for yourself and those around you, because we need each other. So thank you, Dr. Gary. We actually had so many questions for this one. So many of which were similar. So I'm going to try to summarize a lot of those. I think a lot of the answers were probably in this presentation. We're about to go into our Q&A. I just launched a closing poll. I'll close in a moment. But if you could just give us some feedback on the webinar, if you found anything, if you know what you found useful, if you have any tips for us for anything in the future, if there's a topic that you want us to cover. Well, we do these pretty much monthly. I know Dr. Gary is going to take a much needed vacation, so stay tuned for when the next webinar will be.
Our closing poll is on Alzheimer's disease, which is from a different lecture.
Yeah. Oh, it is? Oh, I'm sorry. Hold on. Wrong one, guys. Sorry. I, okay. There we
But we
go.
hope from that other lecture on Alzheimer's, you actually do understand it better.
All right. Apologies for that on my end. Yeah, so disregard that, but thanks if you try to fill it out anyway. Um, yes. So yeah, just check out that closing survey, and then I will go through some questions here with Dr. Gary. All right, so we have one here that says, someone said, mentioning a dental procedure, and then we can take the slides down too. So this person had a procedure, root planning and scaling. They said 20 million times worse. They've had CFS since 1984. They can't do much for the past 13 years. Is there a correlation? I've heard about this before. So is there a correlation between dental work and increasing symptoms of CFS?
So yes, is the short answer. The reality of the matter is you've got a nervous system which is on fire, and anything that you do that excites the immune system, immunizations, overexertion, and overexertion can be spending 10 minutes reading. But dental procedures certainly basically increase pain and increase the reactivity of the nervous system, same as sound and light sensitivity. So yes, that can absolutely cause a crash.
Yes, I've heard of that, exacerbating medical symptoms. Okay, so overwhelmed here. We have so many. So this is something I know that we just introduced. I think that you might touch on this, but someone's asking what tools can be used to help regulate someone's nervous system that's in a state of dysregulation, panic attacks after having long-term anxiety.
So there's a lot, and it's an extremely important question. One of the things we use is vagal nerve stimulators. It's a device that you can use at home, and it's very powerful in terms of quieting down the nervous system and helping reintegrate the functioning of the brain. Meditation techniques are extremely important, extremely useful. Probably active meditation, or either active or guided meditations are best because sitting quietly when you've been as sick as you've been becomes really a hard thing to do. So there are different meditative practices that can be extremely useful, that are helpful. Heart math is another specific technique for doing these relaxation techniques. So there's a wide range of conditions, therapies that can help, and that you can use at home.
Yeah, and then I have a couple of other very similar questions here. People are asking how to manage memories from traumatic effects. Someone similarly has said that they've tried EMDR to address old trauma. Doesn't seem that it's effectively worked, but how would you address pre-existing trauma that just doesn't seem to go away?
That's a big, complicated question, but there are a lot of ways that can be done. Ketamine IVs can be highly effective for PTSD. Hyperbaric oxygen can be highly effective for PTSD. So there are other therapies that can be utilized in the right hands that can help resolve PTSD. So you need to work with somebody who understands trauma, and then these other therapies that are available. Ketamine therapies have been extremely effective, as have the hyperbaric therapies.
Yeah, and I think the vagal nerve stimulation seems to maybe work here. I know I'm not medical, but just from what I've gathered from you and working here, that there was a study that it helped remove, I think, 100% of symptoms for PTSD in a clinical study and lasted for up to like 6 months. So vagal nerve stimulation, something that we just added to the office here in McLean. But I think that just from what we've read so far, it seems to be promising. And then someone here has a question. What suggestions or resources do you have for patients that have an abundance of ACE illnesses? I think this is very similar. I think, yes. Okay. So that one was very similar. How, how to
So
explain?
let me address
Sure.
the ACE illnesses. These are not ACE illnesses, okay? The abuse issues have to be addressed, okay? Because they're part of the root cause of what's going on, but so does everything else that's going on in your life, all right? Do you have mold toxicity? Do you have heavy metal toxins? Do you have infections in your system? All of those have to be addressed, but at the basis, you also need to be doing the therapies necessary to address the childhood issues and to be able to heal those to the largest possible extent that we can.
Yeah. Thank you for clarifying that. All right. So how can you actually get family members to learn and engage in a program like this? We as the individual living with chronic illness, what it's like, but I guess, how can people better express to their loved ones just how terrible they're feeling in a way that's effective for people to understand? Do you have any tips?
It is a very serious, complex problem. So one way is we'll have people come into the office. We'll have loved ones accompany the patient to the office so we can sit and talk, and let me advocate for them and talk about what the illness is and what they're suffering. So I can serve as an advocate in some of those circumstances. Your other physicians, other healthcare providers should be able to do the same. So it is a challenge. And then the other part of the challenge, of course, is um, if you're living with a narcissistic parent or an abusive parent, they ain't getting anything. And the real question is, what do we need to do to help you get safe? How do we get you out of the home environment so that you can, in fact, allow your nervous system to feel safe and calm down, and we can then get the work done. Because if you're still living in an abusive environment, uh, that's an extremely difficult uphill battle.
Absolutely. Unfortunately seen that personally myself, just with other loved ones, and it's a lifelong, I think, journey to figure that out. And then someone had a really interesting question here in the live chat for today. Why do some people, for instance, siblings who have gone through similar stressors growing up, have different outcomes? Like, why are certain individuals more resilient than others?
So there is this thing called genetics. and epigenetics. So we have people who live in moldy environments, and one of them is completely incapacitated by them, and the other one has no problems whatsoever because genetically they can process the mold toxins in their system, and the other person can't. So I've seen twins where one was sexually abused in childhood, the other was not. And the difference in growth and stature between the two of them is quite remarkable. One develops lupus, the other one develops asthma. So the genetics becomes very critical in here, and the epigenetics, what they're exposed to environmentally. So there's differences between us. We're not all the same. And each of us are born with a certain amount of resilience and can tolerate a higher level of stress than others. That's just our genetic makeup. So we expect to see these differences. It is the differences between why people get neuroinflammatory disease, and one shows up as multiple sclerosis, another shows up as Alzheimer's, another shows up as Parkinson's. And yet at its basis underlying, we're beginning to find more and more that we're looking at all of these as neuroinflammatory diseases. So the underlying basics are the same in terms of what happens physiologically, but because of their genetics, the weaknesses within the system manifest differently.
Great, thank you. All right, and then okay, so someone has a question related to PANDAS. They said that they have a child that seems to be suffering from an actual mood disorder. And they've had friends, not doctors, tell them that it might be PANDAS because their kids have PANDAS, but they have not seen their kids express some of the things that you talked about today, like the rage to sweet things. Um, so I guess the question, it seems complex, but I'm sure just overall, if you had like any general guidance, how you would be able to tease apart a real syndrome from something like a mood disorder. I think sometimes those two things get confused